as usual, if you will go to the bottom of your screen and open up your chat box. Would love to hear, first of all, where everyone is joining us from. So give us a shout out. And then that is where you're going to be putting all of your questions today. We are going to be interactive. We're going to be having a conversation. So we want to invite you into that conversation, and we'll try to get to those questions as we go through the discussion today. So my name is Anissa Mitchell. I'm with PMD Alliance, and this is our part 2 of our pre-habilitation of Parkinson's series. And this is in partnership with the DAMIS. And I want to kind of remind you, we did this program a few weeks ago. We had Dr. Gil with us then. He's with us today again. And then we had Claire McLean. So when we were talking about pre-habilitating Parkinson's before, we were focusing a little bit more on, being proactive in terms of managing symptoms, understanding the disease, and thinking a little broader about things that are meaningful to you as you plan out how you manage the physical aspects of your disease. So what kind of leisure activities and things that have meaning to you. And today we're going to be bringing that conversation into the scope of more the social, emotional, mental, and spiritual aspects of your life. And so we want to point out that if you registered and you got a confirmation email, you would have gotten the handouts. They were also included in the last program. They look like this. One of them is this journal that is the Navigating My PD journal. This actually has a lot of prompts in it in regards to emotional intentions, your spiritual, your social. So I would love for you to refer back to that after the program. And then there's a one-pager that you can share with your physician, which looks like this. And it is called the Well-Balanced Life Goals Snapshot Tool. This is something that you can then, after you've completed this journal, you can kind of encapsulate all of those comments and thoughts and share them with your physician so they can understand what is meaningful to you. And having that kind of conversation and a relationship with your doctor is so very, very important. And that is a lot of what we're going to be talking about today, and how to really fit the disease around your life as opposed to trying to fit your life in the disease, So we want you to kind of reframe a little bit about how you're approaching this, kind of improving your wellness, your quality of life from the beginning. So, if you're recently diagnosed, it's not too soon to be thinking about what is important to you. How do you want to set your goals for your care? And then having those conversations with your physician. If you're, further along, it's never too late. So you can start having those conversations with your doctor, and maybe some of the things that we're going to be talking about today will help prompt you. So I want to introduce our speakers. So again, Dr. Gil was with us the last program, and he is a movement disorder specialist down in South Florida. He is in Port Charlotte, and he's been on several of our programs. He runs the Parkinson's program in Southwest Florida. He's a primary investigator. He's been doing over 100 clinical trials over the last few years. He's presents at many conferences nationally, internationally. And he's just someone that I've gotten to know over the last few years, who's got a very compassionate soul and has a good rapport with his patients. And so we're happy to have Dr. Gil back again today. And then we also have Dr. Jill Scarpellini with us today. She actually works with Dr. Gil occasionally. She's also in Southwest Florida. She has a doctorate of philosophy and counseling psychology. She's a licensed psychologist since 2005. She specializes in treating patients who've been diagnosed with Parkinson's, their care partners, treating emotional trauma, relationship issues, depression, and anxiety disorders. And since 2017, she has been the director of a wellness program at the Florida State University Internal Medicine Residency Program at Sarasota Memorial Hospital in Sarasota, Florida, where she's helped develop and implement a wellness curriculum. So I think she's the perfect addition to this conversation today. So I want to welcome both Dr. Gil and Dr. Scarpellini.
Thank you. Thank you for having us.
All
Yes.
right, well, I want to jump in and we're going to start off with some of questions relating to emotional issues. So I'm going to ask the question and I really invite both of you to give a perspective. So the first one, I guess maybe I will ask Dr. Gil and then Dr. Scarpolini, I would love you to weigh in. So from your perspective, how does understanding someone's emotional concerns, their intentions, what's meaningful to them, help you provide better treatment? So if I were to tell you what a meaningful life meant to me, what I value most or would make my life worth living, how do you fit the treatment around my life versus me trying to fit my life around treatment?
Okay, well, first of all, a very sad reality is the negative way in which medicine and the delivery of medicine continues to go through in this country. Meaning, many doctors out there, for one reason or another, uh, they are not providing both the physical care or the management of the physical problems to their patients. That's the only thing they are addressing. And the excuse for that is because they are too busy. Well, if we think about the definition of health, health is the state of well-being physically, mentally, emotionally, and financially. If a person is bankrupt, that person is sick. I may not be able to help that person with the bankruptcy, but I may be able to help the person to enjoy more health as I address his physical problems, which for me are the easy part, but the spiritual and the emotional are critical because that is what makes people happy. That is what makes people enjoy life. Eh, I'm going to be right into experiences in my own family. My mother, rest in peace, lost her right leg to diabetes. And that was a very horrible year because, among other things, not only she was a very vibrant woman and she was working when that happened and so on. I mean, she was still active in her practice. But that year, we also lost my older brother. So that was a very tough year for her. So to recover from those two big traumas took her a while. And not a lot of doctors, but a few doctors trying to address a lot of her physical problems and the prosthesis and this and that and the sugar diabetes, etc. And it wasn't until one day she called me and said, I just realized that God did not take my leg away. He gave me a new one, referring to the prosthetic. Well, that was when Prozac started working. And it was when she was able to find her own happiness and peace and acceptance through religion, through faith, but also to compensate the lack of what the doctors had not done, which was what really was killing my mother was not the prosthesis, was the emotional part. So I tell my patients that I don't care about the little tremor that is now gone. I don't care about, oh, you are walking better. I ask them, how happy are you? There is a movie that I love. It's kind of a crazy movie, but I really like it. It's As Good as It Gets with Jack Nicholson. And there is a scene in which she is in the waiting room of the psychiatrist, and he looks around and he sees all these patients there, and they are depressed, restless, anxious, psychotic. And then he asks himself and to the others, is this as good as it gets? And why do I say that? Because as recent as yesterday, just about every other day, I remind people that if they are being treated for diseases like Parkinson's, which so often involve depression and anxiety, the disease is not treated if they are not happy. Because, big deal, I give you levodopa, your mobility improves. But look at me, all depressed, no pep, no energy. What the hell are we doing then? And yesterday I had a patient that I love, and he has both essential tremor and Parkinson's. But his major problem is chronic depression for many years. And he did very well for a number of years. And when Parkinson's came on, it surprised everybody, including me. And you know what the manifestation of the Parkinson's was? Depression. And this guy went into a bout of depression that I was shocked. And then one of his psychiatrists or psychologists, I don't remember who was, say, oh no, this depression is because of your deep brain stimulation that you had years ago. And that's how he came to me. And we say, no. This DBS that you had for essential tremor has nothing to do with your depression. Anyways, it ended up being Parkinson's. Now he has both diseases very well controlled, Parkinson's and essential tremor. But guess what? Yesterday we were in the office and we were all crying because he is still depressed. And that important is for us doctors to connect with our patients. I am very jealous of my patients. They are mine, and I feel that I am theirs, and I think that I owe them my very best. And if we don't work together, if we don't keep that chemistry, if we don't keep that communication, we are mechanics. Nothing wrong with mechanics, but we need to be better when we deal with the human being that involve also the soul and the mind.
So I think that was very well said, Dr. Gil. And I really appreciate what you're saying, because you're talking about looking at an individual as an entire person, not as a diagnosis, and that you can treat the motor symptoms of a diagnosis, but still not be getting at the heart of what makes that person happy. And that and life is a lot more than just treating the motor symptoms of Parkinson's disease. And it's both the motor and the non-motor symptoms, but it's also what makes you tick as a person and what your values are and what your beliefs are and what is important to you. And one of the models that's been really helpful to me that I also share a lot with patients is in our lives, normal changes throughout our lives. And I'm going to put normal in quotes because, you know, sometimes there's changes that we ask for, that we're seeking out. Maybe it's a job change or maybe we move. But other times there's normal because of the circumstances that gets imposed upon us. And we have to figure out how to adjust to that normal. And a lot of times we get stuck in that place because we're not looking for this change. And the example you gave, Dr. Gil, of even with your mom, with that very, very difficult year she had when she lost her leg and she lost a son, is we get stuck where we can't accept what has just happened because it's so painful for us. And acceptance is different than endorsing that something happened. You know what I'm saying? Those are two separate things. We have to accept something so that then we can be in the moment and we can move forward from that moment. And I had a patient one time, many, many years ago, who was a super successful international businessman. And he lost everything in the course of a couple months. He lost his job. He had to relocate to a different country. And I remember him telling me that for a long time, he felt stuck because he was almost protesting emotionally these changes that had taken place that he didn't want to happen. And he said he almost felt like he was mourning that and he couldn't let go of the old normal to open his hands to receive what the new normal was. And I think with your example from your mom, she came to a place spiritually where she was able to accept, and she had a mental shift that allowed her to accept her present circumstances, and then she could move forward from there. And so I think that's a big concept as we talk about these issues is sometimes we feel stuck because we can't accept that new normal. And that's something that your physician may not be asking you about, but I think is very important, particularly when we talk about emotional well-being.
That's fantastic. And I know even if someone is just in the general population struggling with, the last year and a half of COVID, there's been a new normal thrust upon everybody. And I feel like there's been a lot of people just in that exact place trying to navigate that. So Dr. Scarpolini, we're talking about happiness. And maybe feeling happy is not where someone is right now. Like, it's not that they don't accept it, but just it's hard for them to feel the emotion of happiness. Is there a difference between happiness and joy? So I can still enjoy things, I can still find joy, but it doesn't mean that I'm necessarily happy. Is there a difference?
There's actually a lot written on this topic. There's a whole field that came about in the last 20 years called positive psychology. It used to be we only looked in psychology at problems, or when we were suffering, when we were depressed, when we were anxious. But there was a man named Martin Seligman and some other key psychologists that said, hey, we're missing an opportunity here to find out about the things that actually make people happy and resilient and joyful. And so I think the word that they would use is they talk about enduring happiness. So meaning not just a momentary giggle or a momentary enjoyment, but that kind of more of a sense of peace. And I think it's elusive. Sometimes it comes and sometimes it goes, but they talk about ways of cultivating that. And part of the equation is some of us kind of have a set point in terms of what our personalities are like. And then they combine that with what is your present circumstances. And then the third factor are those things that are under our voluntary control. And some of that is what we were just talking about, our mindset. Is this a mindset of I'm going to get everything I can out of my life from this moment forward? Or is our mindset a more negative mindset? And that's the variable where we have the most control. And I think I'm thinking about your original question, and I think part of that, for example, is issues like gratitude. And so that is actually, there's been studies done in non-Parkinson's populations, but a general population looking at the issue of gratitude. And they gave people an assignment to keep a journal, a gratitude journal, where every day they wrote down 5 things, new things each day that they actually felt grateful for in that day. And they had them do that for a month. And even months later, the people who kept the gratitude journals had more elevated scores in terms of a sense of contentment and peace. And again, Dr. Gil, I'm going to go back to your mother, who that's a perfect example where she lost her leg, but it was the pivotal moment when she could say, I'm grateful for my new leg. And that was something that was totally within her control, meaning how she was going to choose to see that moment in time.
So I want to go, did you have something you want to add to that, Dr. Gil?
No, I just say that I certainly agree with what Jill said.
So I want to go in a little bit of a different direction in regards to some of these emotions. So in a different program recently, we had someone write in the chat that they struggle with fear. So talk a little bit about like those emotions, fear, demoralization. I don't know that we're actually talking enough about these emotions, especially in a disease state like Parkinson's, when once it's diagnosed, it's with them for the remainder of their life. And it's an up and down. You might feel okay and emotionally stable and accepting 1 minute, and then there can be a change, a crisis or something, and it triggers maybe some feelings again. And so, there's a lot of fears of future and a lot of differences for different people and how they cope with that. So can we talk a little bit about fear and demoralization and all these other emotions that might be a part of this journey?
If I may, Jill, because we see the patients in many cases before Jill, I will tell you that one of the most interesting things and critical moments for me in my relationship with my patients is when I meet them and I have to tell them that they have Parkinson's. I learned many years ago that something very silly, like, I mean, everybody should know that it's impacting if you tell somebody, hey, you know, I believe that you have Parkinson's disease, but more so when these people come to you and they don't even know. They come to you for, oh, my doctor sent me here because I'm shuffling or because a balance issue. So years ago, there was this guy who was referred to me because of a numbness in the one arm and kind of clumsiness and whatever. And they thought that the patient had a pinched nerve. That's a famous expression. Or refer to the doctor because of a pinched nerve. And I look at the guy and I really think he knows that he has Parkinson's because I could tell that he had Parkinson's as I met him. And I was young and vibrant and I had a lot of hair back in those days. And I told him as a very casual thing, so have you talked to somebody about your Parkinson's? This guy almost died. What are you talking about? And let me tell you, I lost that patient. He never came back to see me, never. So that experience changed kind of, I became more careful. But what I have done over the years is I explain to patients, from day one, Parkinson's disease is not what you may be thinking about. Parkinson's disease for many years is not what the Pope had, or what Michael J. Fox has, or what Muhammad Ali had. Parkinson's disease today is very different. We have way too many things to treat this condition. And if we treat the patients properly, they do much, much, much better than those famous people that we heard. The other thing that I explain to patients is that there is nothing that gives us more apprehension, fear, and a terrifying experience than ignorance. If we are ignorant to diabetes, I am going to be dying every day because I am taking insulin or whatever. So I tell them education is the best treatment for the fear and the apprehension that we have. Patients need to, through education, be able to manage their Parkinson's. Parkinson's no longer should be managing your life. Because I hear a bunch of people living with high blood pressure. Actually, I hear a bunch of people talking about, oh, my AFib, my AFib. Like if AFib is not big deal. God Lord, I will be dying if I know that I have AFib and that I take Coumadin or Eliquis or whatever. That to me is a time bomb. Parkinson's, we, patients and us, control. So I work very hard to make my patients overcome the fear, because unless I do that, we are going nowhere.
Once again, I really appreciate what Dr. Gill's saying, because I think the knowledge is power. And a lot of times the knowledge is what helps to right size those reactions, because in the absence of information, we tend to make things up in our heads, right? We make up storylines, and we never think about the best case scenarios, or we don't even necessarily think about what's most likely to happen. We tend to think about the scariest, most catastrophic things. And that's where what I think Dr. Gil is saying is so important, because I think with accurate information, it can help right size that. I also want to comment, it's really easy for us to borrow trouble from the future that doesn't necessarily exist. And so we can start worrying. And again, we tend to go to the catastrophic. We don't think about the most likely or the best case scenarios. And so we almost pull out our crystal balls and we do fortune telling in those moments where we're so fearful. And we're writing fiction. We're writing stories that haven't actually happened. And it's really easy to get consumed by that fear, or that fear of being embarrassed or demoralized in some way. And I just want to say, I think those reactions are just super normal reactions. I think that's very, very human. And part of working through and the acceptance that I was talking through earlier, there's times where we grieve, and that's the most normal reaction in the world. Or for example, I can't tell you how many times in my office I've heard about tennis, I've heard about golf, I've heard about motorcycle riding, activities, for example, where people, as they have progressed into Parkinson's, have had to give up certain activities. And there's a mourning process that goes with that. And those are all normal reactions, or fears of walking into social situations, of whether people are going to be heard, or if their tremor is going to be managed. And those are all key parts of our identity. And we're shifting, and we're trying to figure out, what is this going to be like? And part of this is, those are things that are really important to talk about. And I have a colleague who always says that our emotions are a lot like leftovers in the refrigerator. You have to clean them out frequently, or they really start to stink up the place. And I think that's so true in life, but it's particularly true with Parkinson's, because it's such a moving, it kind of moves and changes over time. And it's important to stay healthy, to keep cleaning out and putting these things in words, talking about these things, and then releasing that. And unfortunately, it truly is like the refrigerator. You wish you could do it one time and you would be done for life, but that's not the case. Probably a couple times a week, you're having to dig around on that back shelf and pitch out the takeout container. So again, I just really encourage people that those are normal feelings. I think it is important, though, that we note, in answer to your question, that again, there's a normal range of emotion, and that's how I think of it. And we're up and down. All of us are up and down. We have good days, we have bad days. There's moments we're more vulnerable, where something's triggered us, or maybe we're hungry or lonely, and we're particularly vulnerable in that moment. I think that's different than when the mood is more down here, and that's our range. That's the times where, if our level of depression or our level of anxiety starts to be really persistent, and it's affecting the good part of every day, or it's interfering with our ability to carry out normal tasks, and it's really eroding at the quality of our life, that's the time where we really have to communicate with our team, with our healthcare providers, with our Dr. Gills, and say, hey, I think I might be depressed, I might be anxious, and be evaluated for that, because that's very treatable. And we want you to have the highest quality of life possible. And so I think that's really important distinction. So if you're feeling, if this is starting to crowd out the rest of your life, and that's particularly tricky when we talk about Parkinson's, because we know that some of those non-motor symptoms can predate by a long time the motor symptoms. So for example, you may think that anxiety or that depression particularly is kind of normal for you. It's become kind of baseline. And so when your neurologist is asking you, is there anything new? How are you doing? You don't even think to mention those issues, because they've been occurring for so long that they almost feel normal to you. And so I think that's something that we really have to be aware of.
Yeah, I think that I have made a note earlier, trying to remember to briefly talk about organic depression versus reactive depression, and the fact that organic depression, which is a depression, to make it simple, due to chemical imbalances in our body. Organic depression comes with many different diseases. Cancer patients become depressed even before the cancer has been diagnosed. Well, the same thing occurs with Parkinson's in at least half of the patients. Now, having said that, reactive depression does not respond to drugs, because if I am depressed because everything is going wrong in my business and my life, whatever, there is no Prozac for that. There is no antidepressant for that. And that's where you, as a patient, needs to have the right tools to overcome that negativity that comes with depression and fear. And then if you maintain a negative attitude, a pessimistic outlook, forget it. Your levodopa ain't going to work. Okay. One of my relatives that I love the most say that in the dictionary, the picture of optimism is mine. And because I am very optimistic, and I try to pass that along. And one thing is being realistic and another is optimistic. And I think I'm both realistic and optimistic. Patients make the mistake of always looking at the worst case of Parkinson's, and they see themselves in that case. That's why I tell them that is wrong. That is not the case today. At the same time, you should be your gatekeeper. You should be your first advocate, and you should fight for the right to enjoy best quality of life and best outcome of your illness, whether it's Parkinson's, high blood pressure, diabetes, and so on. But going back to where we began, fear is the product of ignorance. We overcome fears when we know. I often tell my patients, it should be very scary to drive this road at night, and you don't know where you are going. You don't know because you have no maps or no GPS. You don't know what's going to happen next turn. Well, the same thing with our journey with Parkinson's. If you know what Parkinson's is all about, and you know what is supposed to be ahead in the road, you are prepared for that. And you take measures to prevent problems, 5, 6, 10 years from now. Many of these things are doable today with Parkinson's. So we should have less things stressing us when we are told, hey, you have Parkinson's disease. Because I recently diagnosed a person, and I try not really to minimize the problem, but to tell him, listen, believe it or not, patients today are still thinking that, well, a rare disease should be more complicated than a common disease. So no big deal to have diabetes, because everybody has diabetes. Well, let me tell you, I don't think diabetes is a walk in the park. And everybody with diabetes will have significant complications with diabetes. Yes, you could delay and diminish the complications doing the right things. Same thing with Parkinson's. Same thing. So fear is natural at the beginning. I guess one of the things that Gil has done in many programs, including in the upcoming program, is she's going to talk to patients about coping with this disease. And back in the good old days, we used to have a program for newly diagnosed patients and another one for more advanced patients. And the topic that I most often ask Jill to present in the newly diagnosed Parkinson's was exactly that. Hey, let's just understand what is happening. Let's cope with this. In many occasions in my life, I have made copies of the Serenity Prayer. And I can't say which one, when was the latest one, because I don't want to get into politics. But we need to read that many times because it's an amazing way to accept and analyze our own reality.
Well, and I think this is sort of a perfect segue into the topic of spirituality, but going back to the depression and anxiety, you mentioned, the organic versus the reactive. So for somebody who obviously isn't going to respond to medications, if it's more of a situational reactive, someone wanted to know some of the non-treatments that are available. So you've mentioned some of them already, like gratitude is a great way, seeking counseling. So I'm going to let the two of you kind of just quickly address some things that people can do now to kind of help deal with those things.
So you're talking about depression that is more of a reactive depression as opposed to an organic depression. So I certainly think talking to a therapist can be very helpful. Obviously, I'm biased because I am a therapist. But people, again, sometimes people have misunderstandings with therapists. I mean, going to someone to talk about an adjustment or a circumstances that are impacting their mood is a very reasonable reason to go see a psychologist or to go see a therapist. And actually, even Medicare covers seeing a therapist. And so a lot of people are not aware of that. And so, I think some people, particularly some of us who are older, we think that you have to be having very serious issues to go see a therapist. And there's all kinds of legitimate reasons to go see a therapist. One form of therapy, cognitive behavioral therapy, is particularly, I think, adept at like coping skills and tools, and sometimes even within a relatively short period of time can help that individual develop new skills to cope. And we all need to cope, right? I always joke around. When I was a girl, Sears every year at Christmas time would advertise the Sears Craftsman set of tools, the lifetime warranty, every little specialized wrench and screwdriver. And ideally, you give your loved one this whole set and they would have all the tools they needed for life. And I think that's how we are. We go through our life accumulating tools on how to deal with different circumstances in our lives. And so there's times where we need to beef up our toolbox because there are new circumstances that are difficult. And so that's what counseling can do. There's other safe people you can talk to. For example, members of the clergy, trusted friends who the type of people who can keep your confidence, and it can be even a reciprocal relationship. I know a big one that Dr. Gil will mention in a minute is exercise. And again, exercise is tremendously important, not just in terms of helping you physically and with your motor skills, but actually emotionally, it's tremendously important. And there was a study that was out again a while back. It was with a non-Parkinson's population, but it compared, I think it was 150 minutes a week of exercise was as efficacious, was as effective as an antidepressant in terms of helping to improve people's mood. So that's another thing that I would like to mention.
That's fantastic.
Going back to the non-pharmacologic interventions or the treatment of reactive depression, I'm going to tell you that when it comes to counseling, I myself, again, try to share with my patients my personal, my family history, so they realize that I'm one more person here. And I go through the problem that you guys go through. And in 2009, my wife and I went for counseling. And we did it because we were going through something that I didn't think it was for real. I thought that empty nest syndrome didn't exist. Now, let me tell you, even with our two little dogs at home, my wife and I, everything that was going to go wrong that summer went wrong. And when I was coming home, everything that happened or any problem had nothing to do with the dogs. It was me. So I realized that attorneys are more expensive than, therapists. So all kidding aside, we went because we both realized that this was not a matter of taking pills. The pills were not going to bring the kids back home anytime soon and so on. And it was a great experience. It was a great experience because what this woman did for my wife and I was she taught us how to behave. She gave us tools to improve our performance to each other. She gave us tools to realize what our problems were and how to solve them forever into our relationship. And my wife was, I believe, more depressed than I was. I kept myself always busy, and that has been a very easy way for me through my life to, avoid reactive depression. I have found ways in medical school and in internship and in residency and in private practice. Nothing is happening to me because I'm too busy. So again, counseling is amazing. Exercise, as Gil say, animal adapted therapy, music therapy, and music therapy is unbelievable because music, like exercise, increases our levels of endorphins. Endorphins are our natural uppers, our good drugs. And exercise is so darn effective for everything that I am not a morning person. But when, for whatever reasons, I go to the gym first thing in the morning, and then I go home and I take a shower, and I'm in the office by 8:30, 9 o'clock. That morning, bullets bounce on my chest. Nothing affects me. The girls say, "Oh my God, how come you are so good today? And how come you are so happy today?" And that is really the joy of getting high on endorphins. I mean, you can do it. And we could spend a whole week lecturing about that in our program, November 12th, because I always say that my patients don't listen to me about exercise. I have Madeline Hackney from Emory University, and she's going to present the scientific data to explain to patients the benefit of exercise in Parkinson's, motor and non-motor. And I'm going to tell you something that just or recently was published from the University of Toronto in Canada. Even the Canadians know this, okay? Even the Canadians. The group there with Tony Lang took a number of patients with Parkinson's disease, early, middle of the road, and they measure the motor numbers or the motor scores and the non-motor scores. There is a scale to measure anxiety, depression, sleep disturbances, aches and pains, stomach symptoms, etc. You measure all those. And then a group of these patients were randomized, or was randomized, that group, to receive dance therapy for 3 years. 3 years, 3 times a week, dance therapy, a structure, 3 years. The other group, hey, continue your medications and your life and whatever exercise you do or you don't do. And the motor and non-motor scores were measured all along 6 months, a year, 2 years, 3 years. At the end of the 3 years, the group that was not involved in the structured dance therapy, they had the worsening of the scores that one expect over 3 years in both motor and non-motor. Guess what? The other group did not increase. The other group statistically did not advance in the scores for motor and non-motor. Well, the physical part of dancing helped these people tremendously in balance, gait, coordination, flexibility. The music part helped these people in the non-motor, anxiety, depression. They got more joy in their life. They got more endorphins. They activated for free the brain. When you listen to music, especially music that you like, music that you love, you are activating the entire brain. You are putting all the areas of the brain to communicate again. It's like when you have a family that has a problem and they don't talk among each other, and somehow, some way, you get a good therapist like Jill, and she put all of these people to talk. In the brain with Parkinson's, many times, the disease, the overwhelming burden of all this frustration and anger and so on, doesn't allow you guys to enjoy life. Music brings many of these things to a much, much, much better level. And I encourage you to dance. And I am not supposed to do today my Zumba or my salsa dancing that I did last time. But I'm telling you, guys, many times you guys need more exercise, more fun, and less drugs.
Okay, well, the time is just flying by, and you guys are giving such great information. So I do want to spend just a few minutes, if we can, on some of the spiritual things. And you have touched on them a bit as you've talked through some of these other things regarding emotions. So I want to talk a little bit more about why it's important for people to evaluate their spiritual beliefs and then communicate those to their physicians. And by spirituality, I don't mean religion. So you don't have to be religious per se in order to have deep spiritual convictions about something or certain values. But the importance of spiritual discussion with your physicians. And I noticed in an article that I read that many patients wanted to discuss their beliefs, and it influenced how they deal with their diagnosis. They want their physician to understand them better in those spiritual beliefs, and it also influences how they make decisions. So can you both talk just a little bit about how that has come up in your work, and how that is a benefit for the physician from your perspective, Dr. Gil?
Well, again, I am so sorry that physicians, especially this new generation, they have no idea what spirituality is, many of them. And I'm going to go back to the days that I was in training. And there is this kind of a phrase or a joke that people say, well, I don't care about what people talk about you, I like you. There was this professor that I had of infectious diseases, and he was trying to convince me to stay with him. And instead of going to neurology, when I finished internal medicine, he wanted me to stay in ID with him. And he says, Tony, I don't care what people talk about you. Your patients get better. The patient that you care for, they get better. Talking about me interacting with my patients. And I don't really care why my patients get better as long as they get better. And my patients get better when we are all convinced of something that is very cheesy to say, I guess, in the modern era. I truly believe that we are instruments of God and that God is using us to help you guys. And it is a privilege for me to do that. There is no, yesterday my daughter sent me a picture celebrating that she was taking care of this 100-year-old patient. She's a dentist. Both of my kids are dentists. And I say, Sarah, I am so happy for you to see you enjoying your practice. And also realizing that there is nothing better in life that leave your house in the morning, knowing that you are going to help people and that you come home with mission accomplished. And for me, God has done a lot in my personal life, in my family, in my patients. And a week or two ago, there was this woman who came to see me with, a few months ago, severe cervical dystonia. And in the follow-up the other day, she says, Dr. Gil, I want to tell you something that I hope you don't get upset. I say, what happened? Well, I didn't do this and that you advised me, because I think that what is helping me the most is that I have a group in church that is praying for me. And and I say, but why do you say that? You don't even know how much I believe and how important it is to believe. And my mother believed, my mother got better. And if we all believe and we were together using all the tools in our CR's toolbar, we will get better. So please believe, please pray for everybody, because we all need that extra help.
So I actually agree 100% with Dr. Gil that I think we're agents of God. I want to just encourage, when we talk about our spirituality and our beliefs, if we believe in a higher power, even if we don't, we're talking about a large part of who we are. And sometimes we are used to talking about that, and some of us aren't used to talking about that. But it's critically important in the sense of being intentional in our lives. And I think the older we get, the more aware we are of how precious time is. And so I'm a big advocate of being proactive. And so I think talking about what our beliefs are helps bring to our mind what is most important to us. And of course, that's going to inform our treatment. And of course, that's going to inform all kinds of decision making. And to be able to bring into our own awareness and then to communicate with those people who we care about in our lives, to have those conversations, I think is really important, because then they understand how we feel and what we want. And I think that's true with our medical team as well. You know, there might be certain treatment options that we want or we don't want, or even if we're making plans for the future. And I'm actually a big fan of planning. I'm not a big fan of worrying. I think there's a line that we cross there. But even talking about our wishes, like I had a patient communicate to me today, the person was, had just decided to move to a one-story home. And I could tell the person was grieving because they didn't want to sell their current home, but they realized it was important to them to be able to be mobile in their home and to be with their spouse in their home. And they were very bravely making a proactive decision that they then could choose that home and they could make those decisions, planning for the future. And so I think thinking about these things and talking about these things is really, really very important. And again, it puts us in a position of not being reactive, because we have the fewest choices when we're reactive. We have the most choices when we're proactive in communicating and thinking about these things. So again, I really encourage people about that. I'm also going to make a note that I always ask people about their spiritual beliefs when I'm getting to know a patient. And I have come across a number of patients too who have been stuck in their spiritual beliefs. Like I had a patient one time who lost a son at a very young age, and he told me he had not been on speaking terms with God in decades. And so that was so great because it gave us an opportunity to talk about that and to help him get unstuck in a really important area of his life. And that was really important to him in this present moment in making decisions as he moved forward. And for him, he eventually decided, ironically, he had been raised Catholic, and he decided to talk to a rabbi that we identified. But that was really important for him in his process and his healing. So I think the spiritual component is just really important.
And it really makes me think about a lot of people going through an existential crisis when you're given a diagnosis like this at first, and even throughout different times, like you mentioned, somebody having to move, and that's a big deal, and it kind of opens up some emotions. And I think spirituality can be helpful in answering some of those existential questions. It can also be the reason people have some of those existential questions too. So I know that we're running out of time, but I know this is something that we all deal with at some point. Dr. Gil even said he was experiencing that with empty nest. I've just recently experienced the same thing with empty nest. There was that, a little bit of a crisis. What's meaningful? Where do I fit now? So can you just spend just a minute talking about that before we have to end this amazing conversation?
Gil?
I've had such a privilege. I've been a psychologist now for 25 years, and it's just such a privilege because I have really meaningful conversations with so many different people. And this is an issue that if we're honest and if we live long enough, all of us have to deal with this existential issue, right? And actually, there's a famous psychologist named Erik Erikson who talked about the different developmental stages across our lifespan. And he actually talked about the 8th stage, which is when we reflect on our lives. And do we have a sense of integrity? Do we have a sense of despair? Where are we at as we reflect on our lives? And I don't think we land on one side of that or the other all the time. I think sometimes we go back and forth as we're struggling, again, to accept different things in our lives, including our own mortality. And so I want to say to you guys, those are normal things to think about and to ponder. And those are the kinds of things, again, where it's, in my mind, very important to find safe people to talk about those things. When I see patients, one of the first questions I ask, depending on the diagnosis and the person's, I have a lot of people who maybe are confronting end of life decisions. And I always talk to them, how do you feel about death? How do you feel about suffering? And a lot of times we're even afraid to ask those questions, right? And I think those are such important things. What is meaningful in life? And part of in that process is it helps us form our own narrative about our lives. And it allows us to focus on some of those positive things, some of those meaningful things. And again, I'm going to use Dr. Gil as an example, but I heard him reflecting on his mom. And I hear the meaningfulness of thinking back to those moments in his mom's life and how that's informed the man he is today. And those narratives are really powerful for us. So again, I just want to validate those are normal things, and it's important to find safe people to talk to and talk about those issues with.
Thank you for that, Jill. I just want to add one more thing, if I may. Another value or tremendous value of spirituality, religion, faith is the fact that all religions are all about positive attitude, goodwill. The more you believe, the more full of positive energy you are. And it is so much easier to smile than to be angry. And actually, there is, I don't remember the number, but we use less muscles to smile and to be angry. So you consume more energy getting an angry face. And religion gives you strength. Religion make you stronger, more powerful. You are never alone. You are never alone. And there is always a way in which our life is made easier when we believe. And I am not talking about believing in false stories of, oh, you are going to be cured of your Parkinson's disease. No, it's a process of making this treatment more effective to improve one thing, not your tremor, not your walking, but your quality of life.
And I think you just summarized that up beautifully. So I hope that in this conversation today, everyone kind of can see the importance of having these kind of conversations, first with you and your loved one, and then with your treating physician, because they do really impact your quality of life. And again, if you didn't get the handouts before the program today, you will get them following, and they do prompt you through some of these questions of, you know, what do you value and what brings meaning to your life? What are the kind of things you want your doctor to know about you? Because not everybody is like Dr. Gil and is very in tune to that. That doesn't mean they're not receptive to it. So it's important to at least offer that information up, because you are treating the whole person, not just treating, like Dr. Gil said, the tremor or the rigidity. You're treating the whole person. And so that's why we want you to look at this from a more proactive, pre-habilitative, whole person perspective. So before we close out, I want to remind you, if you want to save the chat, just go over to the bottom of your screen where you write the chat and click the 3 buttons where it says more, and then it pops up and you can save chat. And I want to thank Dr. Gil, and I want to thank Dr. Scarpellini for this incredible conversation today. The two of you have great synergy, and you have really given us such an in-depth look at this topic, which is a hard topic for some people, and it's just a very natural topic for you. So I want to thank you both very much for being vulnerable and going there with us. And of course, I want to thank all of you for sitting in this ride with us, because it is a vulnerable session and we are talking some more emotional and meaty things. So I appreciate all of you for sitting in and being a part of this discussion. So Dr. Gil and Dr. Scarpellini, thank you so much for your time. Now there's a tradition, Dr. Scarpellini, you experienced it, Dr. Gil. Dr. Scarpellini hasn't yet, but at PMD Alliance, we have a tradition of a wave of gratitude. So all of our folks who want to wave to you, we want to thank you for your time, your expertise and compassion. And of course, we want to thank all of you for joining us today. So thank you. You guys have a wonderful rest of your day.
Thank you.
Thank you very much.
With all of you.
Thank you. Bye-bye.
Bye.